Knock. Hello. I'm going to do hand hygiene. My name is Lacey. I'm your nurse today. We have an order for a urinary catheter insertion, so I'm just going to double check that. Can you tell me your name and date of birth? And you are Carrie Smith, date of birth 7/17/60 years ago, and that's what I see here. Perfect. So we're doing the urinary catheter today because it says that you've got some urinary retention. So that catheter is going to help drain your bladder and you'll feel a lot better. Do you have any questions at all? No? Alright, so I'm going to set up my equipment and then just kind of walk you through it and we'll go about our business here. I'm going to raise the bed to a comfortable level. I'm on her right side so I can use my non-dominant hand. I'm going to lower the bed rail here. I'm going to set up my equipment. All right. Okay, so I'm going to expose you now if that's all right. Move your blanket here. And then I'm going to help you get into the position that I need you to be in. So I need your knees up like this. Perfect, there you go. And I'm going to don my sterile gloves. Alright, we don't need these. Alright, Carrie, so with this one I need you just to lift your hips for me while we lay this underneath you. Perfect. Just got a couple other things to set up here. I got my lubricant. I'm just going to let this sit in here where it maintains its sterility. As long as it's not falling anywhere. Alright. Alright. Okay, so I'm going to assess the skin on the perineum here, make sure there's no skin breakdown, no signs of infection or drainage or anything like that. And then I'm going to use my non-dominant hand to spread open the labia and expose the meatus. And I'm going to go outside first, anterior to posterior, and outside first, and I'm not going to let the labia close the rubber's hard. And then anterior to posterior down the center. I don't need this anymore. And then I'm going to grab the catheter right here. I'm going to lubricate, and then I'm going to tell the patient to take a deep breath in and then out. And I'm going to twist to kind of get it through. And I'm going to go until I get urine, and then I'm going to go about 2 more inches. All right, and then now I'm going to inflate the balloon about 5 milliliters, 3 to 5. Okay. All right. And then I'm going to gently tug and make sure that that catheter's in there, and it is. And then I don't need this anymore. I'm going to secure the catheter to the side of her thigh or the calf, whichever one is in the kit, and then I'm going to attach the catheter drainage bag below the level of the bladder. And then as far as catheter cares, to clean the catheter, I would unattach it from the thigh, and then I would cleanse the outer side of the labia, and then clean from catheter all the way down and make sure it dries. And then I will clean up here. All right, and you can lift up your bottom so I can get rid of this. And you can relax your legs down. And I'll put the side rail back up. Perfect. And then I'll lower the bed. And my patient teaching was why we're using the urinary catheter to drain the bladder from urinary retention. I did the assessments on the perineum. I think we're good. Please let me know if you have any concerns or any pain.